Correct.
Wonderful. And you also have a master's in exercise physiology, which is really exciting. So we can, jump into some questions about exercise and fitness as well. And I know that you have like over a decade of experience in training people in a variety of different exercises. Is that correct?
Yes.
It's wonderful. And so, a couple things I want to go through today. I know just as a pharmacist myself, there's a lot of misconceptions and, myths around chiropractic care. I personally don't really know too much about it. And, I've had people ask me questions about chiropractors and whether it would be helpful for them, particularly for patients who may be dealing with some pain, chronic pain. And, I don't always know what to share with them because I'm not really educated in chiropractic medicine. So I'd love to kind of, talk with you and go through some of those myths that we often hear, particularly amongst maybe healthcare providers who may not always know the benefits of chiropractic medicine and what it can really offer their patients. Also, some people may not find it beneficial. So, what types of patients would be good candidates for chiropractic care and maybe who would not be. And, a lot of the questions that I usually get as a pharmacist are, concerns around safety related to chiropractic care, safety around a lot of the adjustments, particularly in the neck area. So that's something I would love for you to share and, share your insight on. And then, I know chiropractors do a lot of work related to nutrition as well, which is wonderful. That's a big space that, I'm really passionate about is bringing in that nutrition aspect with any type of care that a practitioner is giving. But really, let's dive in a little bit concerning a lot of these myths that you hear. What are some things that you hear yourself amongst patients about concerns that they may have about chiropractic care?
Yeah, excited to dive in. Just before we get started, I want to thank you for having me on here, and I'm excited to speak about these topics because I think a lot of the misconceptions is lack of awareness, education, understanding, and I think it's really important to have more of these dialogues so we can, just understand what all practitioners do so we can get the patients the quality of care that they need. And then to answer your question about misconceptions, there's quite a few, and some of the ones that you see most often are the fear related when it comes to cervical adjustments, or some people just have an aversion to those cavitations and just being provided care for in that way. And then another realm of misconceptions is that chiropractic is just cracking joints and that it's only a mechanical element. It's not actually beyond that. What drew me to chiropractic is the holistic philosophy in working with the body's innate healing system as opposed to manipulating it. It's all about supporting the body's innate ability to heal, to express health, and that's what drew me in. And even from the chiropractic lens, it's one modality and area of expertise that is meant to work in congruence with, a diverse group of health professionals and a holistic care plan. Yeah, most commonly back pain and neck pain, and pretty much everyone's dealing with that. Well, what's interesting is, and from like the chiropractic side, all of us as colleagues, we definitely want to have more collaboration with other professionals because actually chiropractic's main focus isn't getting you out of pain. We are great at managing pain, but it's really about expressing optimal health. A lot of patients come in when they're in pain, and then they get an adjustment, maybe receive some care, they feel better, and then they stop. The idea actually is once you're out of pain, now we have a foundation to work on becoming healthy, strong, and living the best quality of life. And I think that that is what chiropractic is great at. We live in a society now where people are just, avoiding pain or seeking pleasure, but not investing in wellness long term. And that it's a different mindset. Some people understand that we need to invest into our health. Some people are just like, I just want to be alive and just not be bothered.
Right.
And that's where education comes into play.
Yeah, that's an interesting perspective. I love how you say, it's a part of the care, but then after the treatments, it's focusing on actually living a healthy lifestyle. So I would assume, the exercise, really catering specific, individualizing exercises for people based on their needs. And then also looking at the nutrition component, which is a huge area. I think, we don't do enough of that, is really paying attention to micronutrients, diet, lifestyle, the gut health aspect, all of that, which I know that you're really passionate about as well, is incorporating that nutrition aspect into your work as a chiropractor. So that's great. And then kind of like going back to, some of the myths and misconceptions around safety related to like data for chiropractic care. How would you respond to someone who, has some concerns about data that's available related to chiropractic care for their condition?
Yeah. My father and sister are both cardiologists, and they've shared with me a little bit about the general like mood and temperament with chiropractic care, and the myths and the fear of vertebral artery dissections with cervical adjustments. I gave a talk at a medical conference this past fall, and it was titled "How to Utilize Chiropractic Care in Medicine." And I met with the research team at Life University and basically asked them, because I know that this is something that comes up. I'm not an expert in the field of research, and I'm still learning the data. I'm usually not the biggest data person. I lean more towards science and common sense. But from the data perspective, I've heard like 1 in 200,000 adjustments, 1 in a million, and there's actually no real way to quantify that an adjustment is what's causing the vertebral artery dissection. Now, if there's negligence on a chiropractor's side, there are accidents that happen. I mean, from my sense is it seems like there's a little bit of fear and propaganda around it, because when you step into your car, I mean, how many car accidents happen? When you see a medical doctor, how many medical negligence, or like when you go into routine surgery, there are risks with anything that you do. It just really is, I think, not necessarily fair and like a rational thought process when it comes to looking at chiropractic care. Instead of looking at the benefits and thinking about all the people that have benefit, it seems like the media has just twisted it to where that's what comes up first. But there's millions of people who have received chiropractic care, and it has improved their quality of life. And I would just like there to be more of a fair trade of information.
Right. Yeah, and I think that's why it's important to have spaces like this, is so that practitioners can come together and actually discuss topics like this.
Yeah.
And it probably goes a lot back to assessing the risk versus benefit as well. And then, every chiropractor is different.
Yes.
Right? There's no one size fits all. And every person's philosophy and the way that they practice is different. I've met chiropractors that don't focus as much on nutrition, and they're focused more on the adjustments. I know that with you and I, when we chat about chiropractic care, it's very nutrition focused as well. So you're actually looking at the whole person. You're looking at the chiropractic part as well as the exercise, as well as movement, and nutrition. And I think that's what's important, is that it's all encompassing. Which I think for any field of medicine, whatever type of practitioner you are, we have to bring, all of these components together, and really look at it from an integrative perspective. Yeah, and so I'm curious, how do you bring in the nutrition component with the clients that you're working with as a chiropractor? So, once they get their adjustments or they do that work with you, what is the nutrition and the fitness aspect that you're incorporating post that? And then, also there's concerns about people feeling like they need to see the chiropractor for adjustments. And I know
I really appreciate what you're stating, and we're definitely aligned there. For me, I don't even want to just be called a chiropractor. Want to be known as a holistic doctor and coach. All my training prior to chiropractic is about mastering and simplifying health solutions, breathing, hydration, nutrition, movement, thoughts, stress management, rest, lifestyle, and environmental factors. That is the foundation of health and well-being. And each person has a unique recipe of what they need and where they're out of balance. Naturally, and I can speak for myself, not necessarily all other chiropractors. For me, that is always my approach. And also, not going past the psychology and spiritual aspects of just connecting with someone. I think that those are all incorporated, and that's what it truly means to be a holistic practitioner. Now, to answer your question about nutrition, currently in the model of like where I'm interning, it's something that it's a conversation. In the practice and the way that I would love to serve people is generally we do a movement, lifestyle, nutrition log, so the individual understands and is aware of their daily habits, because that is what's causing most people's dysfunction or function or ease or stress. Now, with just their own awareness, and now with them being able to communicate that with me, we've already made leaps and bounds in their health journey. Now, and what you were mentioning, each one plays such a pivotal role. Like, how can we say which one's more important? But I will say, look, chiropractic care is wonderful, but a person's lifestyle, what they're consuming, what they're eating, how they're moving, what they're thinking. Like, I can literally see someone a few times a week at most and pour the best of my care and my energy and the best adjustments. But if they're not embodying the quality of life they want to live, I can't do that for them. And I think that we can only do so much, but if we can really help educate and inspire our patients to fill all these cups, that's how we're going to have more harmony and more health for our patients.
Yeah, and I really agree with that. I think that embodiment is so critical for any practitioner. Whatever field you're practicing in, you have to be able to touch on all these different aspects of the human condition.
Mm-hmm.
And so I think it's great that you're bringing that to chiropractic care. And I would love for you to share a little bit more about your background in exercise physiology. Also, there's a couple questions that I've gotten about differences between chiropractors, physical therapists, and physiotherapists. So I'm curious if you can touch on that a little bit.
Yeah, I'll start with exercise physiology. Give a brief personal background story just to help understand my point of view. When I was 18 years old, I started weightlifting when I was 15. I had a personal trainer. My dad said I could get a personal trainer if I studied. So I studied to become a personal trainer when I was 15, but I couldn't take the test because I wasn't 18. I was very passionate about athletics and basketball as a kid. So for me, it was like, whatever I can do to be healthier, stronger, faster, and be a better basketball player, that's what I was into. I ran into chronic pain, and I got a personal training degree. I studied kinesiology at University of Georgia. There's certain elements of it. Then I also did a master's degree, but I studied so much informally, experientially. I've torn both Achilles. I've been through so much, and the fitness industry is so saturated with a lot of misinformation, and a lot of people don't understand that health comes before fitness. And most of the fitness industry is based around aesthetics and bodybuilding and an outside-in approach. For me, fitness is all about inside-out, being actually healthy, congruent, being able to, reproduce and actually do what we're meant to do and not just destroy ourselves for the sake of looking good in the mirror. So that's just like a preface, but I've been very passionate about this area, and I've utilized movement as medicine. For me, it's the least invasive, conservative, empowering way to heal, because I can adjust people, and that's a wonderful modality. I think it's one of the best medicines that we have, natural medicines. But then also, if I lead someone through a very difficult training session, and now they're able to do things they are not able to do. That is going to transfer over into their work, their personal lives, their relationships. We're really going through challenging environments together, and when you grow stronger, it positively impacts everything. And like my body, I have quite a resume, like the injuries and the things that I've overcome through movement. And I would say, to segue into what you're saying about physical therapy and a lot of these specializations, physiotherapy, from my knowledge, I think that that's just what they call it in the rest of the world. But physiotherapy and physical therapy is pretty much the same thing. And I think it's very valuable. And I think that physical therapy works very well in congruence with chiropractic care.
Okay.
And
how
yeah.
does that work actually? So would they come to the chiropractor first and move on to the physical therapist, or is it physical therapy first and then
Well,
chiropractic care?
it just depends. So the difference, and a lot of people don't know this, physical therapies work under medical providers. So you need a medical referral to work with a physical therapist. Physical therapists and chiropractors have different training because we are trained to be a primary care provider. So we actually take all the basic sciences that med schools actually take because we are responsible to diagnose. And if we miss like a red flag or something where they need to be referred, that's on us. So we are actually a portal entry provider. Chiropractors, osteopaths, MDs, dentists. So our training is very different because we actually are like an entry portal level of care. So our ability to diagnose is a little bit broader, if that makes sense.
Okay. And then the clinics that you're working in, are you working side by side with medical doctors and osteopaths, or is it usually individually?
It's usually individually, but I'm seeing more and more of that, and that gives me hope. I've always had a vision of multidisciplinary wellness centers where we have more teamwork and collaboration because we all have different subsets and specialties, and I think that we all have value and we all have our place. I think so much of the old narrative is, oh no, like everyone is like, I don't know, like serving their ego and seeking validation, but it's like if we're actually confident and we're in service, like if you have something to offer someone that's better for them, please. I want patients to improve. And I think the old narrative is like MDs don't refer to chiros, and like people are just trying to hold on to patients. But I think that we all have a gift. We all have different knowledge and information to share. And if we can work together and communicate well, then we can provide the best patient care. I think it needs to be about the patients and not about the providers. Yes.
And I agree. I think sometimes as practitioners, whatever field that you're in, sometimes the ego kicks in a little bit, and I think we need to be mindful of that, any practitioner in any field.
Yeah.
But the multidisciplinary teams is something I'm a huge fan of.
Yeah.
I think, every office should also have a pharmacist and, bringing the chiropractor, the physician, the osteopath, all these, teams together works best because everyone's bringing experience based on, the patients they've seen, their own life experiences on the table. And so the discussion really needs to be between people rather than against each other.
Mm-hmm.
And, that's one of the reasons I love to have a variety of practitioners come on my lives to really explain how they're practicing in their space and how is it that we can all come together and learn from each other. So I appreciate what you say about that. I do agree. I think we need more of that engagement where we're all listening to each other and learning from each other. So that's excellent. And then, there's definitely questions around what is the nutrition component related to chiropractic care? So when you're treating patients, depending on their condition, what are some of the nutritional recommendations that you make? Or what are aspects within nutrition that you're paying attention to in your patients? When you're doing intakes, are you asking about diet and lifestyle prior to adjustments so that that's part of your treatment plan?
It's a case-by-case basis. A lot of, the way we show up as providers is listening to the patient, seeing what their primary complaint is, and going from there. One thing that I've learned with working with patients and clients for over a decade and the years and the reps, it's about listening and meeting individuals where they're at. So at this level, I have a lot of background experience in nutrition. I'll tell you, in the day-to-day, I'm not spending as much time. That's more of like an ongoing conversation as we build rapport, primarily from chiropractic. And everyone operates a little bit different. So in the office that I'm working at and in the current style of practice, we're working more on the mindset, movement, lifestyle, and chiropractic side because we don't have as much time to dive deep. But what I always do with each and every patient is always ask if they have questions. I'm here. I've learned to not, and it suits my personality, is not impose because I feel like I have a lot of information, but if they're not ready to receive it and if they're not interested, it may be not the most suitable way to approach it. So I try to share as I introduce myself with patients like my background and that like I'm here, but it's usually, okay, meet them where they're at. From a chiropractic lens, nutrition is definitely a part of it because it's a holistic philosophy, but on the day-to-day, I'm not spending as much time nutritionally coaching. I advise the patients I work with to ask questions as they come up.
Okay. And then for the patients that are coming to you for some of their concerns around pain, what are some foods and dietary recommendations that you make to those patients if, they had a question about nutrition post their adjustment is, what should I be eating? What can I do to really support the inflammation in my body? Like, what are those recommendations that you're making?
Personally, so the way I view nutrition, and for each individual, it is different. We all have our own biochemical individuality. So based on where we are in our life, the season we are in our life, what our ancestors ate, what our lifestyle is like, there's so many factors. The safest place to start is hydrate with clean water, eat whole food, natural, less processed foods that are organic. And if we have access, to do further testing or even, you can muscle test. You can also just take questionnaires, and this is more about the person raising their own self-awareness as well so that they understand what foods work better for them. So I can't make a general statement because look, like we got keto, everyone's always choosing like a diet fad, but we're all unique. And each one of us requires different foods, even like men and women, let's say based on your cycle or you're training more. There's so many variables, but I would say whole food, organic, as close to harmony with nature as possible, and foods that, work well for them. And there is a component that, as I've evolved as a person and a professional, is we also want to enjoy the foods that we eat. We don't want to, I see, and I've gone through phases, but I also see people where it's like fuel, there's no more love or an enjoyment, but that's a huge part of health. And that's in more the subjective realm. So I would rather eat a little bit of things that may not be so healthy if it, makes me happy and gives me energy. I think being too rigid, isn't conducive.
I agree with that. I think sometimes people get really anxious about their diet or their nutrition, and so they're not even enjoying their food. So it's really about, once in a while, it's okay to, eat something that may not be part of your regular everyday. And I think the anxiety that people sometimes have around their nutrition is far worse than some of the foods that they're eating. So it's really about connecting to your food and then also the presence factor, right? I think people are eating without being present, and I think that makes a difference as well. Like when you're eating, try to really disconnect. We're constantly on our phones or people are working while they're eating, so there's like this disconnect between being present with your, food and really optimally getting that nutrition. So I think it's about like calming the mind and then also focusing
same as any other patient. As far as the most important component is doing a great case history and a physical exam. And that each one of us presents uniquely with the symptoms, our anatomy, our physiology, and all the elements of who we are. So if someone has scoliosis, there are different subsets, right? It's of how much a degree of scoliosis and the age bracket. There's many different levels to diagnose. That's a part of what we go through when we actually go through the full case history and the physical exam, and we do any imaging. From all that information, we basically create a care plan. It's like, okay, how are we going to address this? Are we going to use corrective exercises and just chiropractic care? Are we going to implement some traction? Do we need bracing? There's a broad range. You're reminding me of like my different classes in the program, because there's literally like different sections. But the way I approach anyone is the same way. It's, okay, how can I serve you? What's going on? What are your goals? What are your challenges? Now let's create a holistic game plan and format, and let's get you feeling better. And I will provide care, but then also empowering them that, yes, the lifestyle, the nutrition, your mindset, we need corrective exercises. If they're not embodying what they need to do, it's a team-oriented approach. You know, we are going to do our due diligence to serve and provide the best care, but they also have to meet us there. So, and scoliosis, it's just like any other diagnosis. It's whatever the challenge is or whatever the goal is, let's work on it. And sometimes, you know, the body is supremely intelligent. Sometimes we always get ahead of ourselves. Sometimes people have a scoliosis, and that's actually their body way of compensating and what they need. So it's not always about correcting and fixing. I think it's more about accepting, empowering ourselves, and being better, and taking that inside-out approach. I actually had a functional scoliosis when I was younger, just through corrective exercises. When I moved to Miami, like my spine is pretty solidly straight. So a lot of people have a functional scoliosis, and that's one of the main determinants is this structural or congenital? Is it something that they were born with? Or did this happen because they're like hunched over all the time, and they're like on their phone or holding a purse a certain way, and over the years, their anatomy has changed?
Yeah, that's actually interesting. I love that you said that about those differences, and like about posture, right? Sometimes we don't pay attention to our posture, particularly people who are like sitting at a computer all day.
Yeah.
They're usually slouched. So what are some recommendations you have for people as far as posture and the importance of that, and what are tips that you can give people throughout the day?
Great question. I've given a few talks on like ergonomics in the workplace. I'll bring it back to the basics of what I always do, is breathing. The more centered, and what you were mentioning earlier, presence. You know, when we're actually present and we're in our bodies, because even here I'm talking to you, sometimes like we project our consciousness outside of our body. So if we bring it back in, and whoever's watching is like, let's come back into our body. We want, and then there's different elements as far as, thankfully, I chose a profession where I spend minimal time seated and then I'm getting up. We want to move around. If you're sitting a certain way, you want to change every so often. Try to be symmetrical. I've recommended, if you have a standing desk, you can spend time seated. I like 90-degree joint angles. I can't really show it here. I like screens at eye level, or I prefer it. It's what's the safest for the least amount of degeneration on the spine. You can sit like on a wobble disc. You can get one of those stability balls. You can, so sit, stand. I also like a kneeling lunge. You can sit in a kneeling lunge, work on opening up those hip flexors, and then switch. And that gives you like 4 different postures that you could, you know, rotate through. But more than anything, it's presence. And then on every person that we assess, we always do a postural scan. And so many of us have, you know, like the forward head. So we just want to be more mindful, but also posture is not just about, okay, like we pull our shoulders back. It's more about, this is where also the holistic approach to strength and conditioning comes in. And what I stress with patients is, no, you need a strong core, you need a strong back, you need strong glutes, you need a functional, strong body to where you're resilient, you're adaptive to stress, you're more present in your body, you're breathing. I think if we invest more into embodying strength and good posture, we'll have to spend less time receiving care and like adjustments and physiotherapy and massages. I think that we all have an untapped potential, and I just want to help people, achieve that.
Right. Yeah, I think that prevention part is so key. We forget that. It's, we want to prevent all of these things before you actually have to go to the practitioner if you can, or work with your practitioner to come up with a better plan on preventative medicine. So that's really good advice. And then for exercise, I'm a huge fan of bio-individualizing exercise for people. I work with a lot of women between the ages of like 35 and 50, and those years are really critical as far as like hormone changes.
Yeah.
And so the exercises that I usually recommend are a lot of weight training. I think that women don't get enough strength training. I think sometimes we focus too much on cardio, and actually cardio is not super helpful for, building that resilience to a lot of the hormonal changes that are happening in those years. Women are going through perimenopause, menopause, a lot of hormonal fluctuations. So what are some of the recommendations that you make for your patients, based on exercise and movement, depending on where they are in life?
Similar, if I piggyback on what you were saying, is bio-individualizing. For me, everything has to be for that person. I definitely see a lot of patterns, right? We're hunched forward, we have upper cross syndrome, and then we're sitting down too much. So there's a common levels of dysfunction. I think there's just a lot of information and knowledge that we need to make more common, where a lot of even fitness programs or yoga, they're all designed for people who have a symmetrical, aligned posture already. It's not taking into account that your hip flexors are tight, your glutes are turned off, your abs aren't working, you're not breathing in your diaphragm, you can't fire your mid-traps, your rhomboids. So it's like we're going into fitness, but the foundation isn't there. So we're starting fitness programs. So the way breathing, core function, that's the foundation of everything. Because if we're not breathing correctly and we're not utilizing our core, how can any of our movements be in integrity? And this is something that I catch myself just repeating myself, but it took me a decent amount of time to really understand core function and to change it in myself. And this is my career. It's what I'm passionate about. So it takes work. It takes attention. We can't just like stress about everything else and put this off. So that's one layer of it. But I think that we really need to restore health and fitness from the inside out. So if your core, your pelvic floor is not working, it doesn't matter what exercises you're doing on the outside, because you're not even connected from your root. And I think it's really important. Some of the common areas that, another area is we isolate muscles, and Pilates, yoga, every type of exercise, there's no such thing as a bad exercise. It all has its place. But life is dynamic and life is stressful. So if you're laying on your back or you're in a controlled environment, you're not that resilient and adaptive to stress. So for sure, strength training and functional strength training is very important. And there's common areas and patterns that we need to strengthen. And I know, sometimes we just want like answers, but I really value integrity, and I need to have a conversation with someone, see where their mind is at, see what their lifestyle is like, so that I can create suggestions to help, bring their bodies back into balance. And 100% with what you said, I've worked in a large demographic of women of that age group, and the way that I teach exercise is always honoring our minds, our bodies, our hormones. That's how it should be. It should always be health-focused fitness, not the other way around.
Right. I agree. We have a question here. How would you know if you're not connected from the root when it comes to exercising?
Well, thanks for the question. You can always, seek greater awareness, presence with the breath, but that is why we have each other. So I would say you would seek out a professional who specializes in that area, right? It's as far as like a great physio, a corrective exercise practitioner, or a great fitness professional who can really help you understand. And then at the end of the day, it's also our bodies. So we need to take accountability and not just place that trust outward. You can learn, you can research. I am here. That's why I'm doing this, and I've always wanted to create content and a page of trusted information where I just share my perspective, because I've been through it all. I've made so many mistakes. I'm constantly learning and growing, and I really want to share and help people, so you can always ask me as well. But there's deeper layers. I will say that most people I meet, like over 90%, really don't understand how movement is meant to be, because science has led us to breaking down everything, but our body is a holistic system of systems, and we actually have myofascial sling systems that the brain recognizes movement patterns, not your bicep. So I think that there's going to be a paradigm shift, hopefully, over the years, where we start to teach kids and we start to teach people about natural movement and, you know, how we got here as human beings throughout the centuries, because there's been a huge shift in strength training and fitness in the past, like, 100 years. So,
right, and then it's really important to listen to your body, right?
Yeah.
So the more connected you are to your body, you also know what your needs are. And I think that's the importance of like the dialogue between a person and their practitioner.
Mm-hmm.
So you need to be with a practitioner that really embodies listening, active listening and presence, because you need to be able to listen to what your patient is actually going through. It's not a one-size-fits-all. And this is something that I always talk about is we have to get rid of the one-size-fits-all.
Yeah.
You know, you have to tweak things as you go throughout life. And that includes like the type of care that you need, the practitioner you need to be seeing, your diet, your lifestyle, your movement. All of these things change. And so I think it's really about creating that dynamic between the patient and the practitioner, where there's a lot of active listening, presence, non-judgment, and the ability to actually think with nuance when it comes to your patient. And I think it's great that you do that. You incorporate a lot of that as a chiropractor, in addition to, you know, all those other factors that maybe not all chiropractors will pay attention to. So I love that. That's excellent. Let's see if we have any more questions here. So if you have any questions, feel free to put them in the comments here. I'm going to also add Hamad's information at the bottom of the video. So if you want to visit his page, he always has really good information related to exercise, movement, and then also questions related to chiropractic care. You can reach out to him. My practice info is also here. I do provide wellness coaching, so I, you know, kind of integrate the pharmacy world with the wellness world. So I do help people with their medications, but beyond that, it's a big focus on nutrition and lifestyle and movement as well. So I think we'll wrap up a little bit. Hamad, is there anything that, you know, you feel like everyone should take away from this related to chiropractic care, and then just this huge focus on holistic medicine that you're really trying to bring to chiropractic care?
Yeah, I think let's just keep asking questions and let's keep the conversation going. And I'm only one individual as well. I think that we all just need to seek more holistic understanding as well, and apply critical thinking to everything that we do, right? And take everything with a grain of salt. I really agree with and love the points that you made about, you know, not having a one size fits all. It's really about listening and developing that trust and rapport. You know, sometimes I start with breathing. I teach it a certain way, and I try to communicate like, this isn't all there is. This is just where I can tell that this is where your level of awareness is, and this is what I'm being called to share with you now. But it's always going to be refining, right? So it's like, I think that if we can stop seeking like the black and white and the answers, and we can be along for the ride, there's no destination. We're always going to have to invest into our health and well-being. We're always going to be an active participant. There's no I have arrived. It's going to be a constant journey, and I commend you. I love the work that you're doing as well, and even sharing different professionals like this. So if we can just keep the conversation going and ask questions, and hopefully, you know, we see strides in our health and well-being as we go.
Yeah, and it's just really working together, right? We can't be separate. We have to come together as practitioners in order to provide the best care.
Yeah.
And I love when you start with service, right? You always say that is you're serving people.
Yeah.
And I think sometimes we forget that as healthcare providers. You know, our presence is really about service. It's how can I better this person's life?
Yeah.
And I think also that takes a level of work on yourself as a provider to kind of come out of the ego and really, really focus on that service aspect of what is best for my patient. And then also, if you can't provide the care that they need, being resilient enough and out of your ego enough to be able to refer them to someone. That's the key as well. We have a question here
great
about,
point.
can you tell us more if you have wellness retreats? So I don't have any wellness retreats at this time. It is something that I'm interested in doing at some point. Hamad, I don't know if you lead any wellness retreats.
Yeah, I have. I was just gonna plug. I was gonna make that weekend collab, but I actually am going to participate in a retreat. I'm actually driving. It's in North Georgia later this evening, and I have like a block where I'm just gifting service to all the retreat participants. So I'm doing just private postural and like corrective exercise, chiropractic evaluations. It is something that I have led a few retreats in the past, and I'm a guest in some, but it's something I would like to do more of. And I think the more that we come together, the more we can do that. And a vision I've always had is wellness retreats for health professionals, not an 8-hour continuing education day, like 2 hours of continuing education and all fun and wellness the rest of the time.
Yeah.
So putting that out there, but yeah.
Yeah, I agree. I think wellness providers need to have fun too, right?
Now.
They're a little bit too serious.
Yeah.
You need to be playful, and it's a collaboration, right?
Yeah.
And that's really key. All right, any more questions? I'm trying to make sure we got everything here in the comments. Okay, so this was great, Hamad. Thank you so much for coming on and sharing your experience. I will, again, link Hamad's information at the bottom of the video. Thank you, everyone, for joining, and we'll do more of these as we go.
Can I say one thing? I was reminded, so it's International Women's Day, correct?
It is.
So congratulations to you. And then I want to just like have a prayer offering that, hopefully we can call in for all our women around the world, like peace in their hearts, joy in their thoughts, and harmony in their health and their bodies.
Yes.
So.
I love that. Thank you so much, Hamad.
And then, sorry to cut you off, but I wanted to put that in there.
No, that was beautiful. Thank you. And I know all the ladies on the line appreciate that as well. Thank you, everyone. I hope everyone has a great day. I hope you get to go outside, take a walk, get out into nature, get some sunlight.
Yeah.
Have a great day. Thanks, Hamad.
All right, thank you.